All right, everybody, we're going to get started here. And I need to do the nutrition one over again. So I'll try to make this quicker since I already have this screen written down. I'm not going to rewrite it. So we'll start with these three vitamins. There's thiamine, folate, and iron. The things that are highlighted are things that you really should understand and know. So let's start with thiamine first. Thiamine deficiency we'll see in alcohol abuse quite a bit. So that's when you see people with IV bags with the yellow in it. That's like your B vitamins and all these other vitamins that they need because they are deficient in it because they're chronic alcohol. If they have a deficiency, you may notice some nystagmus, although it's kind of hard if they're intoxicated. But basically, nystagmus is a definition to say that their eyes are kind of jittering back and forth. So I drew an eye here. Also, they can have tremors, but think of the eye tremoring, blurred vision, and Wernicke-Korsakoff's is actually from like real long-term chronic alcohol use, and they have neurological issues. They don't walk right. They have a lot of motor deficiencies from drinking too much alcohol. Okay, and let's move on to folate. Folate is folic acid, and it's real important to take in childbearing years. And especially if somebody's pregnant, they really need to be on a supplement. So that's really important. It takes months to show symptoms if you do have deficiency. So talking about deficiency, uh, and this brings it up here, B vitamins, uh, B12 deficiency particularly, and folate go hand in hand. They're both macrocytic anemias, meaning that the blood cells are enlarged, they're big, and so they just go hand in hand versus the opposite, which would be more iron deficiency anemia. So folate deficiency can also mimic a lot of the same symptoms of B12 deficiency, like neuropathies, hands and feet tingling, mouth burning, and stuff like up here. Although there's something that is hallmark and it's gray hair. So obviously not everybody with gray hair has folate deficiency, but if you see a young person, you might want to, and if they're having symptoms, it's like, I wonder if they have a folate deficiency, although people are dyeing their hair gray now too, so. Also, an important thing to remember is taking the synthetic form is more absorbable and available in your body than food sources. So please remember that just because of the types of food that we're eating, we're just not getting all of the folic acid that we need, and it's really better absorbed in the pill form. We shouldn't take anything in mega doses, so just remember that. And all of these are stored, so folate's stored in tissue, so whether it be lung tissue, heart tissue, muscle tissue, that is where it's stored, and it has to do with your nerves, as you can see, the side effects, neuropathy, things like that. So we don't want to be deficient in that. And then we talk about iron. Iron's really important regarding safety. So we want to make sure we keep out of reach of children because there's iron supplements and there's vitamins with iron. There's plain vitamins, but regardless, we need to keep medicine out of reach of children. But the iron, just know that because it can be very toxic and deadly. And then for elderly too. But just remember safety for children on here. As far as treating them, we give them supplements. So I give them ferrous sulfate, that's iron, and 325 milligrams. Now there's different ones over the counter that show like elemental iron. I always do the prescription because I know what it is, I know it's controlled, and I know what's going in their body. I have them take it 3 times a day, but it can be hard on your stomach. So it can cause black stools, constipation, nausea. So you want to build them up. So I start with 1 a day. Oops, I'm doing the old-fashioned Latin, 1 a day for a week, and then I go up to 2, and then I have them take 3. Now, in order to take this to be absorbed correctly, it needs to be taken on an empty stomach with orange juice if possible. So this would be the only thing you'd recommend to take with it, just because it has vitamin C in it, and it helps the iron absorb. And no antacids, especially. It doesn't mean you can never have antacids, but just make sure they're taking at least 2 to 4 hours after and at least an hour to 2 before they're taking the iron, because it's not going to absorb correctly, as we learned in the other units. Also, if someone has nausea and vomiting, you just want to tell them, just let us know if you start having this unusual nausea and vomiting, because again, wheat can be toxic. It is a fat-soluble supplement. All right, and let's go back now. I'm going to get you get a new page here. Actually, I'm going to erase this all, and I will do, because now we are going to go over water-soluble vitamins and fat-soluble vitamins, and then that'll be it. All right, so what are water-soluble versus fat-soluble?